All right, everybody, good afternoon. Thank you for joining us on today's webinar, Healthcare Plans Available to ESA Member Companies. So retaining current staff is something that we have heard a lot about from our member companies, from industry companies, and it's been especially challenging in the post-COVID economy, with supply chain shortages having impacted products as well as the labor market. Offering quality health insurance can differentiate a company that is looking to retain and hire quality staff, but access to affordable quality health care has been difficult to attain. ESA's Member Savings Program grants access to multiple health plans with tremendous flexibility to meet the various needs of our member companies. This webinar will showcase easy-to-implement, affordable coverage options that provide flexibility with coverage for both W-2 staff and 1099 contractors. My name is Sophia Dominguez, and I'm ESA's Director of Membership, and I'll be facilitating our discussion today. Before we dive in with Michael, our health insurance expert from Chatham Group, I'd like to provide some tips for those of us joining for your first ESA webinar. First, welcome. ESA, or the Electronic Security Association, is the largest and longest standing association serving the pro-installed electronic security and life safety industry. Our members are integrators, dealers, and monitoring centers, and even manufacturers and service providers in this space. We are the voice of the electronic security and life safety industry. If your company is a member in our association, thank you. And we're hoping you're taking advantage of your ESA benefits to leverage growth and connections for your team. If your company is not yet an ESA member, check us out. You'd be surprised at the power of ESA membership. Get a feel for all the ESA benefits, including savings on business insurance, training, sales team coaching, certifications that satisfy state licensing, and more at esaweb.org. All attendees, you guys will be muted for the duration of this session, but that doesn't mean we don't want to hear from you. If a question or comment comes to mind at any point during today's session, click the Q&A icon located at the bottom of your screen, and we'll pose them to our expert today. There's no need to save those questions until the end of today's presentation, however. If something pops up, just go ahead and ask us, and we'll ensure that we have time to address your questions today with Michael. We're also recording today's webinar, so you can re-watch the on-demand session and share with your colleagues. We at ESA realize your time is valuable, and we appreciate you spending some of that time with us today. Now, before I jump in and introduce today's speakers, I'd like to highlight the ESA benefits and programs that are relevant to today's webinar and give a little bit more detail about the Member Savings Program. ESA member benefits are not one size fits all. We customize in providing tailored solutions to meet your needs and optimize your bottom line. Our case study that you see on your screen here into how members use their ESA benefits in 2021 highlights the value of membership in programs such as our MSP program. Speaking of insurance, Security America, ESA's own insurance company, was formed to be an ally to the electronic security, life safety installation, and monitoring industries. We know firsthand the risk your businesses face every day. Offering general liability, errors and omissions, umbrella coverage, workers' compensation, commercial auto, and cybersecurity coverage, we've got your business covered. ESA members, ESA members receive a 20% discount on your policy premiums, and our policies are backed by Lloyd's of London. Last year alone, ESA members saved over $700,000 on their policies. And if you're looking to hire qualified professionals, the Foundation for Advancing Security Talent has you covered, also known as FAST. This foundation was a conglomeration between the Security Industry Association and the Electronic Security Association, hoping to bring talent acquisition solutions that are industry specific directly to you. FAST is a job board that is industry specific for job postings and resumes, and yet another way that we're helping you guys solve the problem of hiring new talent. And ESA members are getting free job postings for the remainder of this year. Not only that, our National Training School offers certifications and training for all of your professional development needs. We have over 70% approval by local authorities having jurisdiction across the entire United States. And also, ESA members get discounts on these courses. The ESA member savings program is focused on maximizing your collective purchasing power to secure cost savings on everyday operational expenses. Today, we're just talking about the health insurance program, but the list is long, from anything from fuel, fleet management services, shipping, payroll processing, credit card processing. We've got your entire business covered with this program. Now, our B2C portal allows you to offer your employees with an employee rewards or employee perks program, just another benefit to increase those savings and offer them to all of the employees within your company structure. All right, without further ado, I'm going to introduce Mark Chavone, founder of the Member Savings Program. Member Savings Program accompanies over 150, I believe. Let me not get this wrong, Mark. I'm so sorry, because I know you will correct me. So the Member Savings Program has over 150 trade associations, and their 250,000 plus member companies is why we can offer such the deep discounts to you guys today. So, Mark, please take it away. Thank you so much for being here.
Thanks so much, Sophia. I appreciate the introduction and the overview of all the benefits that ESA brings to the table. Obviously, those alone pay for members' dues many, many times over. And our objective at Member Savings Program is to bring even more value and savings to you and increase that return on your investment. We have everything, as Sophia mentioned, from the day-to-day operational expenses that might be small, but some that are very, very large, and those all add up, and the members save significant money if they engage with the services. And again, as Sophia said, based on the aggregated buying power of the groups that we represent, we can bring real meaningful savings to you as members. Today, the focus, as you know, is on health plans and health insurance, which is such a key both acquisition as well as retention tool for employees. As you know better than I do, that is one of the top concerns of employers, is to get good people in the door and keep them. One of the things we hear all the time is we need to provide benefits to be competitive in the industry and get good talent. And so today I'd like to introduce Michael Kachidurian. He and I have worked together for several years, bringing different insurance and health plan programs to the table for the different associations, including ESA, that we work with. And Michael's going to go through a little bit of the options that are available to you, and hopefully this will be very informative. Michael, take it away, please.
So, Mark, thank you for the intro, and I'm happy to be able to participate with ESA in this webinar. I've worked with Mark for several years, and we've learned that many of the association members are looking for opportunities to bring some degree of healthcare to either themselves as the business owner or their employees. So getting access to quality medical care at reasonable rates is a challenge for many members. Through Member Savings Program, ESA is able to bring two different options to member companies and their employees. The first option is a comprehensive major medical plan designed for successful business owners and independent contractors. We can enroll as few as one person from your company, or if you've got some 1099 contractors, you can make this program available to them and they can pay directly through your membership in ESA. The enrollment is open every month, so there's no need to wait till year's end in order to enroll in the program. The medical plans are available in all 50 states. So regardless of what state you're in, there might be an employer that has employees in multiple states. We can cover them with the same plans in all 50 states. There's also uniform rates for members 18 to 64. What this means is, regardless of your age, whether you're 25 or 55, the pricing will be the same. What we found is in many states, plans for small employers or individual business owners are age banded. And so the older you get, the more expensive the program is. There's also no surcharge for smokers, or whether you're male or female, or in specific states. So the pricing is the pricing regardless of age and what state you're in. This program offers 6 different plan designs. We utilize 2 national PPO networks. 3 of the plans are offered using the Cigna national network, and 3 of the plans use the Anthem national network of providers and hospitals. And these are PPO networks, which means that you have open access. You don't need referrals to get to specialists in the program. Anthem offers an HSA option. And because these networks are so broad, it's very likely that the preferred providers and hospitals that you would want to use are going to be in network. On the website, which we'll get to the website in a second, you're going to be able to look up the doctors or hospitals that you might want to use right from the website. So that's a benefit. And the enrollment site is the same place where you're going to see the prices and plan designs. It's a single sign-on. So as the next tab says, websites include additional coverage for dental, vision, accident, or guaranteed issue life insurance. You'll just have to complete the information one time. It's a single sign-on, and whatever plans you pick, you'll feed those plans into the enrollment portal. It's an easy to enroll 24/7, fully automated enrollment and correspondence website. So if someone applies for coverage, which all the coverage starts on the 1st of the month. So if someone's interested in applying for coverage, there's a window from the 18th of one month to, well, I should say the 19th of a month to the 18th of the next month for enrollment the 1st of the following month. So once you apply for coverage, you will get correspondence via email or text as to where your application stands in the process. To review the plans and the pricing, we would have you go to this website, which is https://eliteenroll.com TBGMSP. And once you're there, you would need to enter the access code, which is PKCT 2925. Just as a note, these plans are not available to the general public. These are limited distribution plans. So, through Mark and his affiliation with many associations, we're able to bring this plan to associations like ESA. But if you're just, somebody off the street, you're not going to have access to these plans. The pricing on these plans is going to be very favorable compared to what's available on the exchanges. I'm not saying that in every case they will be better, because some states have different pricing modules and have established their own exchanges. But by and large, what we've found is that the pricing on these plans is generally about 15% below the exchanges, and the plan designs are much richer and the networks are much broader. If you folks have any questions about these plans, you can give me a call at my number there on the screen, or you can email me. As Mark said earlier in the presentation, because one size doesn't fit all, we've had very much interest in trying to find an alternative to a full-blown major medical comprehensive unlimited plan. So unique benefits that small employers find attractive is that they're competing to attract and retain employees. And how do they do that? Well, many folks find that comprehensive medical plans are out of reach financially. And so they are faced with a choice. Either we don't offer anything, or we offer the plan, but not enough people participate in it. So one way to differentiate your firm and search for talent is to offer affordable medical coverage. So this program is specifically, this option 2 program is specifically designed to make coverage available to W-2 employees at affordable rates for both the employers who want to subsidize the cost, as well as employees who want to cover their dependents. We've had a number of people who said, look, the only way we can get the pricing to a point that we can afford is to really strip down the benefits. And when we do that, either people still can't afford the plan, or if they do buy the plan, the deductible is so high that they defer going to get care because they don't want to have all of that out-of-pocket expense. So some of the provisions of this plan that are really quite unique and have been, we've generated quite a lot of interest from some of the associations I work with Mark on. So it's guaranteed issue. There's no medical questions to answer. And this, we have it bolded because it might be one of the most important things. There's no upfront deductible to receive benefits. So this is really rather important because instead of having to incur a $3,000, $5,000, or even an $8,000 deductible before you can start receiving benefits, with this program, there are copays, but once you meet your copay, you're able to start collecting or you're able to start getting benefits immediately with just a copay. So there's 3 plan designs that have different levels of benefits. And like the first plan, there's uniform pricing. It's available in all 50 states. And again, whether you're 25 or 55, the pricing will be exactly the same. And the plan designs will be the same regardless of what state you're in. With this program, we need a minimum of 2 employees enrolled to implement the program. Now, there's no minimum participation beyond that. So let's say you had 10 employees in the company, but only 3 or 4 of them needed coverage. We could write the 3 or 4 people without a problem. That's just not available in the small group market because generally they want a minimum participation requirement of about 70% of your employees to enroll. This program too has enrollment available every month. So there's no need to wait till that year-end enrollment period. People can enroll every month of the year. This plan has simplified enrollment. If you enroll by the 15th of the month for a first of the following month effective date, your coverage will be in place. I want to emphasize that this program does have some limitations. It has limitations in terms of the number of visits and services that people can get. However, it covers doctor visits, it covers prescriptions, it covers lab work, diagnostic testing, and it has some coverage for the hospital. So with the way this plan's been designed, it will cover approximately 85 to 90% of what people might need over the course of the year. However, if someone has serious medical conditions, this probably isn't the right plan for them because at some point they'll max out on the benefits. But we've had quite a bit of interest in this plan from both company owners as well as the employees that they're looking to provide some kind of insurance for. So again, in order to review these 3 plans and rates for these plans, give me a call at that number or send me an email and I'd be happy to talk to you about how the programs work.
All right, everybody, I want to open up the kind of chat for any questions. So there's a lot of information regarding health insurance. So I know some of you guys might have some questions. I had someone send me this question. Michael, can you offer this, or can a company offer this program to their independent contractors and have them pay directly?
Yeah, that's a very good question. So yes, in option 1, the program is available to 1099 contractors. They would go ahead and fill out the enrollment form and put in their own information in terms of billing so that the program will draft the premium out of their account once a month, generally the last week of the month, for coverage the following month. But yes, it can be offered to 1099 contractors, and the employer is going to have no responsibility. I know for many employers who have to walk that fine line with, I don't want to have my 1099 contractors. I don't want there to be a paper trail and have somebody come back and tell me, oh, wait a minute, they're really employees. There's a reason they have them as 1099 contractors. But with this program, we could insure a 1099 on the same program that the business owner might want. It just wouldn't be on the same bill. The 1099 contractor would get billed directly for his coverage.
Fabulous. There's another one here for you, Michael. How do owners and partners work in either option?
Sure. In the first, and that's a really good question, because sometimes in, the entity is structured as an LLC, so maybe they're not taking a salary. It becomes a Schedule C type of arrangement, but they could definitely apply for coverage in either scenario. In option one, we only need one person to apply in order to gain coverage. They'd have to go through there's some medical questions with option one, so you have to answer those medical questions and then get a response from the program. But in the second plan, again, even if we have a business owner who's not, technically a W-2 employee, but he owns the business and works full time, and has another person that they want to insure. And I tell you, one of the nice things, the flexibility of the second program is, if we had a business owner and their spouse that were really the only two people working in the company, we could write them both as singles, or one is a single and one has maybe the dependent children on the plan with them, so that we could meet that minimum of two people in the plan. We've done that a number of times and it works fine. So there is a lot of flexibility with these programs, and frankly, we've also seen scenarios where the business owner might want option one, but he wants to put option two in place for some of his employees or her employees, and they could do that. Again, that's, speaks to the flexibility of these plans.
And then another question for you, Michael. Our firm is located in Florida. I pulled up both the Cigna and Anthem information, and I see deductibles listed, but I thought I heard that there were no deductibles. Did I hear that incorrectly?
The second option plan has no deductibles. The first option plan has deductibles in all 6 of their programs, but in option 2, there's 3 plans and none of those plans have deductibles.
That makes sense. And then I got a question. Does the 1099 contractor have to be an ESA member? And I'm sure Mark, me, and Michael can kind of answer that. Ideally, yes, the 1099 contractor would have to be an ESA member through their company, right? So it would depend on that company having an active membership and that 1099 contractor being associated with that member company.
That's correct.
Right, and this is Mark. Just like all the programs, the gasoline programs, insurance programs, et cetera, that is for active ESA members, and that's part of the benefit of being a member. So we extend that to ESA members only.
And then I've gotten a couple questions regarding the slides and the information in the slides and following up with attendees after this webinar. Yes, we will be sending the slide deck and there will be the session recorded on demand for you guys to come back in and listen to and watch. Absolutely. And then Mark, let me ask you this. What are some of the newest services that many members may not know about through the MSP? I know you and I have talked about some of those programs that have come up in the last 2 years. So kind of, can you explain that a little bit more to us?
We're on the lookout for more programs, more services to add more value to the members. Several of which we're on the eve right now of launching a very aggressive T-Mobile program to help businesses save on their telecom cellular needs. That'll be coming out shortly. We also launched Discount Tire, which has been a very popular program. Just a little note on that. If you have 5 vehicles or more, you're eligible for this program, and it'll save you some really good money on something that we all need to buy from time to time. And by the way, if you have trailers, which some of you do, that also qualifies as a vehicle toward the program. So Discount Tire and T-Mobile is the newest, but one of the most impactful and quite frankly, a little surprising was our Batteries Plus program. Batteries Plus bulbs, they've rebranded as Batteries Plus recently, has been incredibly successful for the member savings program, and especially for ESA members who are buying especially the 12-volt batteries, which are, very important to you all, obviously. And there's some savings, tremendous savings. About $50,000 was saved by just one ESA member last year due to that 12-volt battery savings. Really deep discounts. I would encourage people to take a peek at that. So those are the newest and most impactful changes.
Wonderful. And then Michael, one for you. I know you mentioned the kind of the comparison between these policies, this coverage compared to what's on the typical exchange. Can you talk a little bit more about how these prices and plans compare to what is available on the exchange?
Sure. So the exchange programs typically have very high deductibles. And if you don't qualify for a subsidy, which many business owners don't, the pricing is expensive. And lastly, the network that you have access to, one, most likely will be only in the state that you're in, but two, it's a fairly narrow network. So many of the providers that you might want to use are not in there. Whereas with the option one program, the network of providers, Cigna's national network or Anthem's national network, is very broad. You could go to any state in the union and get care in network. The pricing, as I said, I think earlier, is you're going to find is going to be about 15% less, and the plan designs will be favorable compared to what your options are on the exchange.
Wonderful. And then one more for you, Mark. How much does the average member save in a year?
That varies, but average about $14,000 a year is what it amounts to. We have obviously contractors, we have distributors, we have manufacturers of all types all over the United States utilizing our program. So some save, as I mentioned before, Batteries Plus, that $50,000 savings. Much more than that. Some save less than that, but the average is about $14,000, which obviously pays for your dues many, many times over. So, so those are the metrics.
Wonderful. And then I just launched a poll for you guys. All the attendees on here, we'd love to get your feedback. We know that our member savings program and all of our benefits, that there's so much that's a part of those programs, and even our members might not know everything about them. So we'd love to host more of these and talk more about those programs and benefits that are available to you guys. So if you're able to, please answer our poll, and that'll give us an idea of what content to share with you guys next time. And thank you so much, everybody, for joining and spending part of your afternoon with us. We very much appreciate it. We look forward to seeing you next time. And again, we will be following up with the slide and also with the recording of this webinar so you guys can review. And we invite you to reach out to not only the ESA membership department, but Mark and the MSP program, as well as Michael with Chatham Group for the insurance. And we'll absolutely be sending that contact information out to you guys as well. Well, thank you guys so much for answering that. We will be taking this to heart and putting to work the next webinar. Thank you guys so much for joining us. We appreciate it. I hope you have a great afternoon. Thanks, Michael, and thank you, Mark.
You bet. Take care. Enjoyed it. Thank you.
Thanks, guys.